Hey everyone, Todd here, internalarchitect.com. In this video, I wanted to do an update on what is happening in my next steps of treatment and what's going to end up happening probably for the next about 2 weeks or so. It's a little too difficult to really come up or to try to speculate on what is going to happen, but so yeah, but before I begin, please hit subscribe below and hit the bell for notifications so you know when I put out a new video. So yeah, so I had a conversation with Dr. Francois, Reg Francois, and we talked about what is going to be happening next, and that is because, so I have to rewind here a little bit. So 2 weeks ago, yesterday, we did a biopsy of a lymph node in my armpit that was showing some signs of growth. And what ended up happening is those samples that we got from the needle biopsy came back inconclusive. Yeah, so this is this is going into the frustrating part of all this cancer stuff, because you think that, you know, all this technology and all this stuff works. Well, sometimes it doesn't, and that's kind of what happened with that. Is the samples that we got were just not enough to really confirm that my Hodgkin's is still the same thing that we have been dealing with up until the end of December. So fast forward to today, I finally had a discussion with Reg, my surgeon, and there was a couple things that they needed to discuss. One was my past treatment history with radiation and everything else, and the other biopsies that I've had and all this stuff. So what they're going to do starting next week is I'm going to go in to the Shaw Cancer Center, and actually the Sun and Out breast cancer section of Shaw, and I'm going to do a consult first thing with Reg, the surgeon, and then right after that they're going to place what is called a mag seed, and that they're gonna just numb me up. It's gonna be just a quick outpatient thing. Probably not as painful. Well, it wasn't very painful because they had me all numbed up, but they're gonna go in and they're gonna put what is like a magnetic element into a lymph node in my armpit, and then so this is on next Tuesday, which will be May 5th. So yeah, so on May 5th that will be happening, and then that is on a Tuesday, and then on Thursday, on the 7th, we're going to go in and actually do a surgical biopsy of the lymph node. We're actually going to just remove it and get it out of the way, or just pull it out, and that way they should have enough tissue sample to make sure that everything is the same. Now, the reason why we want to make sure is I've been through enough treatment at this point to we don't want to speculate on what is going on, and if for some reason that this has morphed into something different. And that is really the main reason, because that can completely change how we approach treatment moving forward. So at this point, it's just a matter of making sure that the Hodgkin's is the same, and then continuing through with treatment, or continuing with whatever the treatment is going to be. I'm pretty confident that the Hodgkin's, it just hasn't gone away yet, so it's just whatever. And it's such a minor amount of disease that's going on kind of in through my armpit and kind of in this general area, right? And that's the whole thing. That's why this biopsy needs to happen. It's a lot of cutting, it's a lot of probing, after we pull this one out. So it's just it's going to be a bit of a delicate surgery because there's just a lot of muscle and stuff that's going on in here, and that's why they just want to be right with it. But it's funny because it's all of my most of my main surgeries that I've had because of lymphoma and biopsies and stuff, aside from a bone marrow and a liver biopsy, have all been on my left side. So, and it's all been on my armpit. So I have a couple really good scars in there that are make it pretty interesting. So that's what's happening coming up this next week. So I'm actually kind of glad because it gives me a little bit of time to do some stuff to work on all this and keep producing some videos and whatever. But at the same time, it gives me a little chance to kind of get on the bike a little bit, as this is like one of the nicest weeks we've had this spring to start. So I'm going to take advantage of getting on the bike a little bit, and since we're all kind of isolated still, even though some of the restrictions are starting to lift, I've been getting on the bike a little bit, and it's been great. So yeah, so that's what's happening. If you have any comments or questions, please hit me in the comment section below, and I will get back to you. You know, and the big thing is, if you have questions, please let me know, because I would love to help you understand what and why this is going this way. So awesome. Thank you for watching. I appreciate your time and energy, and I will see you on the next video.